quarantined, etc., and that it depends on where you come from. There was a company that approached the government to say, can they make private arrangements with individuals desirous of coming to Grenada to help facilitate all of this, basically like a tour operator or a travel agent. And we said yes. So that entity is providing that type of service. They will assist, and especially between now and 1st of August, where we do not have any commercial flights coming from red or yellow zone countries, they will assist in with if there's a charter available, or to mobilize enough individuals to organize a charter to make sure people get their test, to tell them where, because we are aware as well in some states it's very difficult, if not impossible, to get a PCR test in a timely manner, unless you have been referred by a doctor because the doctor believes you have, and not simply because you want to travel. So they will facilitate in that. They will make sure that all of the required health declaration forms are filled out before the person boards or before the person travels. They will make sure that the appropriate quarantine facility here has been arranged with the individual, because remember, individuals must pay for their own quarantine. It is not at the expense of the state. So all of these things will be arranged by this facilitator, the same way that a tour group or travel agent would arrange those things. And the government has given permission to that. The government is not paying the individual. The individual gets no funds from the state. The individual just offers a service to people desirous of coming to Grenada, and if those people choose, they can engage that entity. What was the last part of your question, Linda?
I think it had to do with the persons trying to illegally enter.
Right.
Yeah. Well, during our whole COVID response, the issue of small boats coming in has always been something we managed in the past. Fortunately for us, we managed it well because we had good collaboration from the citizens of Peter Martinique and Carriacou. So that wasn't a big problem. The issue that we speak about here, though, it was a yacht, international yacht that came in. It was not anything to do with our sub-regional entry.
Yeah, and I think also with respect to inter-island traffic, not just good cooperation with the people of Carriacou and Petit Martinique, but also in terms of facilitating an access point to allow people from Union, because, for instance, when they had the terrible gas station fire, the only gas station in Union, but to allow a mechanism for individuals to come back and forth under a controlled environment, that allowed us to monitor that traffic. And our issue is that we want to be able to monitor all traffic, and that's why we say individuals must notify us, other individuals must notify us before entering our waters.
Linda, thank you, Minister and Dr. Martin. I see, Linda, you want to clarify something? Go right ahead.
Yeah, Minister, the company that we spoke about, you said the company approached government. Is there room for that? If another organization or a company want to offer similar service, can they also approach government with their own proposal, or it is just locked with that single company?
No, it's not locked to that single company. They have approached government. They were told, well, more of a no objection from government, that yes, they can proceed. They have made the necessary arrangements to have clear and interaction with the Ministry of Health and the various other government entities. And if there's someone else that wants to offer that, we would be open to that as well.
Colleagues, anybody else, or are we through? You have 10 seconds. Seems as though they've exhausted their questions. So, Minister and Dr. Martin, I'll give you the opportunity to make a few parting words.
In closing, I'll be happy for our country folks to keep supporting us as we've always done during the COVID. If you continue to do the preventative measures, as I've said from the beginning of our COVID experience, if you follow the advice that we're giving to you, we are expected to reap good dividends. So keep trusting What we say to you from a ministry standpoint, keep protecting yourselves. Continue to eat good, bright-colored foods, especially now that the borders are open. It is even more important now to eat bright-colored foods and drink lots of water. Rest a lot, protect and improve your immune system, because the worst is yet to come, if you want to put it that way. So let's all be careful.
Yes, and in closing, just simply to add to that, yes, we have won most of the battles that we went through so far with COVID, but the war is not over. There are more people infected now daily with COVID-19 than ever before, and those numbers keep increasing. So let me repeat that to put things into perspective for those who think they can throw caution to the wind. There are more people infected now daily worldwide than ever before, and the numbers keep increasing. The possibility of one of them slipping through the nets that we have put does exist. Should that happen, and we are all following protocols here, the risk is limited, minimal. But should that happen and we're not following protocols and we're having street parties on the beach, the risk is significantly increased. And I think as individuals we need to be responsible and not just simply rely on the Ministry of Health and the government to save you when you get into trouble.
Thank you very much, Honorable Minister Nicholas Steele, Minister for Health, and Dr. Francis Martin, the Acting Permanent Secretary in the Ministry of Health. Well, I think you've heard it all. We need to be as cautious as possible, especially since from tomorrow, July 15, the airport will accept commercial flights from countries across the Caribbean region. Although deemed as low risk, it was pointed out that there are some people trying to circumvent the situation, and we need to be as cautious as possible. Thank you so much for being with us. I am Leslie Ann Johnson. Have a great day, everybody.
All right, guys, and we are back, and that was the press conference from the Ministry of Health. And sitting at the table, we had the Minister of Health, Honorable Nicholas Steele, and of course the Acting Permanent Secretary within the Ministry of Health as well, Dr. Francis Martin, giving us a synopsis of the protocols, what is expected to happen, and also appealing to our better judgment as a people in terms of following the protocols, keeping safe. What do we do, especially now in this time? What do we do as a people to ensure our safety? You know, because we are all responsible for our own safety. We're responsible for our health. We're responsible for our safety. The facilities that can help us to improve our health, right? Government is responsible for ensuring that there are facilities available. However, we are responsible for keeping ourselves healthy. All right. The protocols can be put in place, but at the end of the day, we must choose to follow them, right? It is our decision. So from the synopsis that we got, Mr. Pollard, do you want to go first, or you want us to?
No, you continue. I will join in as you give me an opportunity to.
You know, if you leave me, I'm talking for the whole day. So yeah, you have to.
I'm not restricting you.
Everybody knows that you are my what do they call those things
I'm
again?
your friend and your co-host. Just make it that easy. Don't get this thing too complicated. We are already very complicated due to the fact that some of our citizens feel that there's no need to continue to obey protocols.
Yes.
That's a complication. I mean, I really don't want to see, as I've heard some people say it, I really don't believe that Grenadians are downright careless or wicked or just wanting to be delinquent in their behaviors. Maybe what they have done could be qualified as being delinquent, but I don't think they downright want to be that way. The euphoria of we have some freedom now, you know, let's utilize it, and they have dropped their guard.
Yeah.
And we have been saying here on this program time and time again, we just don't know where and how a case can slip in. And it was clearly explained by both the minister and Dr. Martin that despite the fences that have been built up, because the protocols and all of this protection measures are like fences, trying to determine who comes through the gate. Yes, so the borders are opening up, but we still want to have some control over who comes in. It's not the floodgates are not open, so everybody just running. Yes, these fences are there. There's a gate, and there will be gatekeepers. So we want to make sure that we examine who comes through the gate. But you heard it. There are still people trying to slip through little creaks and cracks and holes. You know, it reminds me of when I was much younger, very much younger. Yes, I was young at one time, even though last time Duncan made
Not
it absolutely clear that
Not
I'm
me.
significantly older
Than me, exactly.
than her and a host that we had in here. A statement that my wife doesn't enjoy and like at all, and she told me I must tell you about it anyway. But those days when I was much younger, and the Simone Pavilion, where there's an intent now to build a cultural center, used to be a place for shows and semi-finals for carnival and so. And around the facility was galvanized fencing. Right? And somehow, somebody would always be able to pull aside, remove the nails, rip through a little portion of galvanized somewhere in a corner. And it's oftentimes in a dark spot. I don't know if they used to do it during the day and have it prepared for when night comes. And a few of us would always slip through. We were young, didn't have money to pay to go to a show, you know. So people are always trying that. That has been from time memorial, yes? And likewise, they're trying to do it. Grenada is seen in the eyes of a lot of people, not just in the sub-region, but even in international communities, as a safe haven. People admire the way in which we have been able to deal with the COVID situation, control it. As I've just learned, they say we are superior with TTT. They say we test, we trace, and we treat. Yeah, TTT, not TNT, which is Trinidad and Tobago. TTT, test, trace, and treat.
Right.
We have done that exceedingly well, and so Grenada is seen as a place where people think they can come and be safe, but some of them want to circumvent. Dr. Martin clearly explained that an international yacht attempted to circumvent all of the procedures that they had to do to bring in people with them. But luckily, because we have our people who have been very vigilant, they found it. But how do we know for a fact that despite our best efforts, a couple of smaller boats, not necessarily a yacht, can leave the islands? We are very closely knitted. We can be hopping from one island to the next.
Yeah.
We saw the case with St. Vincent, who was declared clear, or they declared themselves clear, and now they have 6 or 7 cases.
Right.
Do we want that? So, hence the reason we keep saying that as there are greater easements, the protocols for certain things in terms of the lockdown, the curfew, and so have been released, and so we need to still be cautious. We need to still take very good care, meticulously. We have to watch what we do, the way we do it, where we go, how we interact with each other. You know, no gathering of more than 20. That's what the protocol says still.
Yeah.
And people continue, or some people continue to make the point, well, we're COVID-free. Oh, the government said, the ministry said we don't have it. Yes, we don't have any medically tested case here in Grenada, but we don't know where and where the next case is coming from. And if we are not cautious and we are not following the precautions, we can easily fall victim to it and easily spread it throughout the country.
But also, Mr. Bola, we don't know how the next case will present itself. We don't know if it's going to be somebody who is asymptomatic. We don't know if it's somebody who is going to be present with mild symptoms and not take it seriously. So we don't know how the next case is going to present itself. And that is all the more reason why we have to be ever so cautious in what we do. We have a caller on the... Oh, we seem to have lost the caller. If you're listening, please try giving us a call again. But we have to be ever so cautious because we just don't know. And as they said, we have people trying to slip in. But even still, Even if we didn't have anybody trying to slip in, we still have our port export and import ports that
Yes,
operate.
yes,
You
yes.
know, a case could simply come from there. And then we wonder, oh, well, was the government hiding? No, they weren't hiding. They have been honest and open and clear on the situation that we have been in. There is so much information out there as it relates to COVID-19 that at this point, people should be masters, should have certificates. You know, they should be experts in the actions of COVID-19. And of course, you still can't be experts because the information changes as time goes by, you know. We have a caller on the line. Good morning.
Good morning, Ms. Duncan.
Hi, good morning.
Mr. Bowler.
Good morning,
Good morning.
Good morning to you, sir.
Morning. I've got some questions. One is being clarified with the minister on that yacht. Because at times I ask, and I even ask the police at the
Commissioner?
the immigration officer.
Oh.
I didn't ask him about those yachts and them coming in, how they take them.
Yes.
But I seen this morning that we get them catch.
Yeah,
We
they
catching them.
do have to check all of them. They have to
Yeah.
they have to actually ask permission to come in because our
Yeah.
our territorial waters are not free. They must.
Yeah, and I was wondering how they monitor them coming
Yeah,
in.
yeah, they do.
But I know we catching them.
Yes.
But the next thing, the next question I want to ask, I don't want to get us off a trend, but as trilineal states, Grenada, Carriacou, PD, Martinique,
Mm-hmm.
when you travel with a Grenadian passport.
Mm-hmm.
And when we identify them in Grenada, we don't identify them as Carriacouian out here or PD Martiniquans out here. But in Grenada, we identify them as Carriacouians or PD Martiniquans.
Mm-hmm.
And when they get a passport, they're labeled all as Grenadians.
Yeah, we are all Grenadians.
So if we have anything in to smooth that out. And then the next thing I'm asking again is that, like with the virus, I heard somebody mention this morning about like if you catch a virus somewhere, they made reference to the president of the United States, like putting a disclaimer that folks get contaminated in the environment.
Mm-hmm.
But how can someone say or point out where they got contaminated, where they got attracted? You take the bus from your one point to point A to point B. You can't say if you get it when you're coming off the bus, when you're getting on the bus, when you're reaching town, or wherever.
Just listen
So
for
how
1
can
minute.
you-
Just let me stop you 1 minute.
Okay.
What the caller was in particular talking about, the president was having a rally. He was having a rally. He didn't go into all the details, but we know about it. And he was saying to members of his party, before they come to the rally, they all had to sign a declaration to say that by coming to the rally, if after they come from the rally, they contract COVID, that he and the party cannot be blamed. That's what he was really making reference to. It actually
Yes, I
happened
understand that.
in the U.S., yes. So
I
he
understand that,
he
but
didn't
what
want
I'm
to take
saying-
no blame. They didn't want to take no blame, so they say sign. Whether it's there you catch it or not, they didn't care. Just sign to say you come into the rally.
But in any way you can identify that is where you get it.
No,
So
you may
yes,
not be
the
able to.
disclaimer is on.
Yeah.
I understand the disclaimer.
Mhm.
Understanding the disclaimer. But if you go to a court, you can say definitely I got contaminated by you. I got injured by you. I got hurt by you.
Yes. You're
So
right.
if you can't there's not a winning case.
Mm-hmm.
I want to deal with this. On island, if the ports are closed and all the cases in there are neutral, nobody here have the virus. How possible it is that it could be contracted if nobody have it, nobody's tested for it, and everybody on the island, let's say, is free, and they can't, intermingle with one another. What the possibility is that they getting it if they doesn't have it on the island. And have a blessed day. I listen for your answer. Have a blessed day and love you all.
Thank
All
you
right,
much.
you
Thank
too.
you.
Mr. Paula, let's tackle the question of Carriacou and P.T. Martinique and Grenada, because I don't think you understand what he was asking. He's saying that overseas, it's identified in Grenada. We identify as Grenada, Carriacou, and P.T. Martinique.
Yeah.
Overseas is identified as Grenada.
Yeah.
How do we rectify something like that, where it's identified as Grenada, Carriacou, and P.T. Martinique on the passport? And I think that is one of the things that the referendum would have covered.
Yes, they attempted that. Yes.
And of course, lack of understanding resulted in us not, well, not us, because I voted for yes for that, for Carriacou and P.T. Martinique to be added to the passport. A lot of people thought that when you clicked yes, it was yes to everything, and it's not to the particular bill. And that was a bill on its own, where Carriacou and P.T. Martinique would be added to the passport.
Yeah, because it has to be a constitutional change in order for that to take place.
Yeah.
So
the referendum would have dealt with that. To his question, the latter part of his question, where he mentioned, if there's no cases in Grenada, everybody's intermingling, how is it that we're going to end up with a case? And that is quite simple, because Grenada is not completely and totally shut down. Remember, our port of export and import ports, they are open, they're operational, because of course food needs to come in, things need to come in.
So cargo vessels are coming in.
Cargo vessels are coming in. They don't drive themselves, they have crew as well. So there can be that interaction, that contact on those ports that can allow for some sort of infection. We haven't had a case thus far of that, and we are grateful for it. But you just never know. So you don't want to just play luck and chance with people's lives like that. It is a possibility when you look at all of the circumstances. If it were a case where the entire the whole of Grenada was shut down in the case of import, export, commercial and international travel, regional travel, all of that was completely shut. We were confined to our country by ourselves with no means whatsoever of somebody entering. Then we could say, all right, fine, we're safe. But all for now, that is not something that we're looking at, because we do have access.
From the viewpoint that we are very proactive and vigilant, and we're trying to block every entry point, or check at every entry point. I mean, look at the Grenadine Islands. You know, you have Carriacou, you have P.T. Martinique, you have Union Islands, and all those little islands up to St. Vincent. Now, there are over 6 or 7 cases in St. Vincent at the moment. Who is to say that a fisherman, for example, didn't get into contact with one of the cases in St. Vincent and out on sea, and they do exchanges, they take petrol. I think there was a fire at the gas station in Union Island, and so now the vessels that were taking gasoline there, I think they are allowed to come into Carriacou, P.T. Martinique or some. There's some protocol in place, and of course they do the very best they can to minimize contacts and what have you. But who is to say that someone who is asymptomatic, as we have been saying, someone who has contracted the sickness but shows no sign, someone who has been tested but comes up negative, but in truth and in fact really has the virus and has the capability, based on the science, have shown that if you are asymptomatic, is that you don't show up on the test, but you're able to spread the virus. We just don't know. So that's why we continue to say the precautions are necessary. Follow the protocols until and when things have changed and the official voices say to us, look, now we don't have to worry about anything. But outside of that, it is good hygiene and healthy practices for us to wash our hands regularly, not sneeze or cough in public, that we cover our faces with a tissue and discard of it properly when we are finished, and all of those things. They are just basic hygienic things that should become traditional for us, that should become things that we want to do every day. So COVID, while it has its cases and areas of that are disadvantageous to us, there are still, I believe, in some instances, some positives that can come out of it. So we need to continue to follow. Yes, we can debate whether it makes sense or not, because in the minds of some of us, we feel if we are COVID-free, we are COVID-free. Nothing can happen. In the minds of the experts and the medical professionals and those who have to deal with the sick people on a day-to-day basis, let's just continue to observe the protocols, because it can just match in like a thief in the night from anywhere, anytime. So we just have to be careful all the time.
We have a call on the line.
Good
Hi,
morning.
morning, sir.
People, I was speaking earlier, before the press conference.
Yes.
Don't talk about the constitutional right. But there's a lot of right that we should be following, because as parents, we have to protect our family. Right? And then when we go out, we care and we go there, and we don't obey the protocol, we don't know what could happen. And we catching that, and then we going back home. What happened? That we endangering our family. We even also endangering the community where we are living. Right? So I believe if we obey and we obey the protocol, we could save life. We could save life, because if we care and we love people, we are there to protect, to give them the right information, to protect and to save them from danger. Because look at the constitutional right. Look at if you don't obey that, look at the consequence. You go, you catch it, you go back home, your family, between the among the people in your family, and in the community where you live in. Let us where we did the two areas and see which one is worse. Right? It's worse. Your family, you endanger your family, endanger your community. Right? It's worse than when you be just you don't care about people, you care about yourself, you care about family and community, and you go there and do and catch it and bring back home. You check the same government, the same Ministry of Health, who give the protocol, the World Health Organization, is the government that have to still come back and assist the people, because we can't say, well, they don't obey. We have to we still have to protect, we still have to get the right treatment for them to see that they become healthy. Even so, when we as friends go there and we be we don't care, we still have to find the money, right, for our family. So I want to say to the Grenadian people, let us obey the protocol. When we obey, we save life. We save life. Let us obey. Because obedience is better than sacrifice. Let us obey the protocol and the World Health Organization guidelines. Mr. Uncan, Mr. Bolava, wonderful.
Thank you. Thank you so very much. And it is not to say that some people are not obeying it. There are a lot of Grenadians that are. I move around. I see people who obey. They continue to wear their mask and do whatever is possible. But we still have some that are not. So, those of us who feel that we shouldn't, let's start thinking differently. Let's start being more patriotic, if we can use that word, in wanting to care, not just about the person, the individual, but care about, as the gentleman just said, family, community, and country at large.
Absolutely. Now we're winding down for time. If you didn't hear yesterday, I'm going to say today again, we start the program now promptly at 10 o'clock to facilitate the playing of the national report at the end of the program, as opposed to playing it at the beginning. But keep in mind, guys, the protocols for the reopening of the airport, it's of course it's a phased approach, and it begins tomorrow. You can visit our Hard Talk Grenada Live Facebook page to view the forms and to view what the protocol itself is. And of course, maybe tomorrow we'll go deeper into discussion of the protocols, what it means for the people in the OECS and Carriacou, and what it means for you in the rest of the world. There were a few questions I'd hoped that the media asked during the press conference, such as the GPS watch that would be provided to them. How would that be provided? How do they download the app that they need to download before they enter the country, and all of these things I was hoping would be asked before, but I'll try to source the information for you so that at least tomorrow we're able to provide you with that information. Guys, as per usual, it's always a pleasure speaking with you. Mr. Paula, do you have any closing words?
Well, I just want to remind people, the press conference was very, very clear. I think the minister was straight to the point, so towards Dr. Martin, about what is expected to happen from starting tomorrow, God's willing. The green zones, or the zones that are considered to be lowest risk. And I'm happy that they did explain that would be countries that over the last 14 days had 19 or less cases. I
per
knew they
thousand.
per thousand, per 100,000.
Yeah.
Yes, 19 or less per 100,000. So you could have had more than 19, but if you have, for example, 200,000 as your population, that would be what, 38? Because
Yeah,
it goes
that.
up per 100,000. Yes, and then the yellow zone is 60 and less per 100,000, and red zone is more 60 and more per 100,000. So they explain, and that is how they categorize, and I guess that is information coming from CARFA and the World Health Organization. The protocols are in place, the testing, the kits are here. The minister did say that we have at least 15,000 rapid tests, which that's about a 3-month supply. Now both hospital and SGU are able to do the PCR testing, and they have the capacity to do up to 300 per day. So if needs be that both sites have to be used, up to 600 people per day can be tested. So these are all good news. But while all of that is good, friends, I just want you to know that NNP has shown you time and time again that we can take people out and take this country out of difficult situations. I know we believe that God is still a Grenadian. I know we believe that Dr. Mitchell and his team is blessed. I know all of that. And so we take it for granted that we can do as we wish and everything would be okay with us. Please, 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 for your sake, for the sake of your family and loved ones, for that of your community and your country, let us continue to obey the protocols. We can do a lot together. We can help each other if we work together. We are in this period, and we are fighting this COVID together. Thus far, we have made great strides. But to repeat what the minister said, we have won quite a lot of the battles we have fought with COVID already. But the war is not yet over. Please obey the protocols. In whatever you do, wherever you go, try to have some kind of face covering. Keep your physical distance as much as you can, as is possible wherever you are. Continue to wash your hands regularly. Continue to keep your hands out of especially when it is not washed or sanitized, out of your face, your eyes, your nose, your mouth. Be careful. Continue to obey, as they call, coughing and sneezing etiquette, especially in public. And let's keep ourselves safe, as well as keeping our community, our family, and our country safe. We thank you. We'll have to break here, and remember that it starts at prompt 10 o'clock now, and we'll close anyway between 11:40 and 11:45. So be safe, be good. Have a terrific Tuesday, everyone. And we'll hope, oh no, you won't be hearing me tomorrow, God's willing. I'll be out. I don't know who she would have with her, but I won't be here for she to be smiling to and crossing her eyes when she feel like to. But I do wish you would have another wacky and wonderful Wednesday with Miss Duncan and HARDTALK. You do take care.
Guys, it's always a pleasure being here with you in whatever you say and whatever you do. Be safe, be secure. We always want to be talking with you. Oh, and never about you. Please do enjoy the remainder of your day.
Stay up to date with all that's happening with the new national party, NNP. Send us a message via text or WhatsApp on 405-8683 with your name, email, and constituency. Stay in the know with NNP. Get updated.
More than 7,000 Grenadians have benefited from COVID-19 stimulus package and unemployment benefits. We'll have details to this story and more in the national report. Welcome back. With the details to the news for Monday, July 13th, 2020, I am Rikisha St. Louis. More than 7,000 Grenadians have benefited so far from the government's stimulus package and unemployment benefit. The economic stimulus support package covers payroll support to businesses, income support to self-employed individuals, and unemployment benefits. Chanel Andrews is responsible for public relations in the COVID Economic Support Unit. During an interview with the Government Information Service, she gave an idea as to who are some of the beneficiaries.
Thus far, we can say we had over 600 bus operators benefiting from the program. We also had other categories such as tourist vendors registered with the GTA, Grenada Tourism Authority, taxi and tour operators. We also had, on the payroll support, more than 3,000 employees within the hotel and hospitality industry benefiting from the payroll support, and other tourist-related sectors such as marinas, yachting businesses, and restaurants and bars, in addition to small travel agencies.
Various sectors and individuals who have been affected by COVID-19 have applied for the stimulus package. The ministry continues to accept applications, and data is being collected to determine the way forward. Additional businesses have been added to the list of beneficiaries, inclusive of the Royalton workers.
Recently, we also had approval for hairdressers, barbers, and market vendors to benefit under the program under income support. And to date, 277 market vendors have benefited from the program. The program has also took into consideration in recent times the 250 laid-off employees of Royalton Hotel, in addition to 120 aviation services of Grenada employees.
When it was first announced, the stimulus package covered a 3-month period. With the pandemic continuing to impact the closure of borders and restrict economic activity in some sectors, the Prime Minister has indicated that government is considering a 3-month extension of the support granted to hotel workers. However, while government is sympathetic to the plight of workers dealing with reduced income and loss of jobs, government itself is limited by the significant decline in revenue. Continuing with the news, the Ministry of Works will be embarking on a sanitization project at the St. George's Market during this week until Sunday, July 19th. That announcement was made by Permanent Secretary in the Ministry, Marina Jessamy, on Monday during a meeting with the first group of vendors at the facility. P.S. Jessamy explained that although Grenada has no active COVID-19 cases, booths and other commercial spaces will be cleaned before the vendors officially return to the facility next week. She says a series of meetings is scheduled for this week to ensure that the vendors comply with the request of the ministry to sanitize the facility.
There are different groups of vendors, and so today, Monday, the 13th of July at 10 o'clock, we hosted a meeting with the vendors that are outside in the market with their own umbrellas and their own booths. Tomorrow on Tuesday, the 14th of July, 10 o'clock, we will have a follow-up meeting with the vendors of Building 1. These are the spice vendors. And on Wednesday, 10 o'clock, we will have the meeting with the vendors at Building 2, where is the commercial part of the market. This is very necessary so that we can have a dialogue on the sanitization project that started in the market, and to make sure that the vendors can comply with all the COVID-19 protocols. The point is that we don't have active COVID cases, but we continue to ensure that our vendors will comply.
Member of Parliament for the Tongue of St. George, Honorable Peter David, commends the Ministry of Infrastructure for taking steps to ensure the safety of vendors and consumers at the St. George's Market. He says government is aware of the issues with the market even prior to COVID-19 and is working to implement measures to address them. Minister David is pleased with the Ministry of Infrastructure for initiating engagements with the vendors.
Ministry of Infrastructure has engaged with the vendors at the market, with the businessmen and businesswomen. They've engaged with them to discuss the way forward. Of course, over the last couple of days, we've heard a lot about issues at the market, and the issues are simple. One is, how do we ensure that it's safe? How do we ensure that COVID-19 is not spread in the market? How do we ensure social spacing, as they call it, physical spacing? And how do we ensure that the environment of the market is conducive to conducting business? Because at the end of the day, these are businessmen and businesswomen. And if the conditions are not proper, then they will not attract persons to come shop. So those are the issues confronting the ministry.
The sanitization project will include power washing of the grounds and booths, drains and tables. PS Jessamy highlighted some of the areas of concern that surfaced during the dialogue.
So far, I must say that the meeting was very dynamic and they cooperated well. They are very passionate about the recommendations that they made, issues about security, issues about selling of alcohol in the market, issues about the fact that some of them are at the stadium and they sit alone there. They feel that they do not get sale as much as when they are in the market square. So we want to appeal on all the vendors to cooperate with us. The sanitization project started yesterday, and we will continue until next week, Sunday, that is Sunday the 19th of July.
Other infrastructural works, such as the erection of tents and construction of tables, will be done during this period. This is the National Report. The news will continue after the break.
The house was shaking. Then said the story here, babe. Crack, and the roof had gone.
Man, I was so scared, I nearly wet myself.
Only those who have lived it can truly understand the devastating fury of a hurricane's wind.
The house across the road just get up and roll over.
Hurricane force wind. It's a hazard. Hazards. Take control. Reduce your loss. You can hurricane-proof your home. For example, make your roof more wind-resistant by using screws instead of nails in its construction. Find out more about hurricane force winds and other hazards at your local disaster office.
A message from the National Disaster Management Agency and SEDERA.
Welcome back. The St. Patrick Road Upgrade Project, which was put on hold when COVID-19 halted work in the construction industry, is now 55% complete. Work commenced on the project in June 2019 and was scheduled to be completed by June 2020. However, a new deadline of November 2020 has been set. It includes construction of culverts, drains, retaining walls, and concrete reinforced sidewalks. On Friday, Works Minister Honorable Gregory Bowen and Parliamentary Representative Pamela Moses toured several of the projects in St. Patrick. It includes 6.8 kilometers of road between Duquesne and Sauters and 8.2 kilometers from Pointsville to Montfendu. Works and Infrastructure Minister Honorable Gregory Bowen says the overall project cost more than $22 million with funding from the OPEC Fund for International Development. He says negotiation has commenced for the second phase of the project.
This was a project of about over $20 million and funded by OFID, the OPEC Fund for International Development. So we had to split it in two. And we split it in such a way, working with the consultants, that not all of the jobs happened on St. Patrick's East. The other part of the job is ready to go, designed and everything, and we are now prepared to talk with OFID so that we can have on the western side all the roads that were omitted, so that we can flow from one into the next. And remember, it is one project already tendered. It's just that the funds are not there, so we just have to apply to OFID now and say we want to do the second piece. And I have had initial contact with them already, and they are willing to do the funding.
The Pointsville Bridge is an important structure that serves most of the villages in the parish. Parliamentary Representative Pamela Moses is pleased that the bridge is nearing completion.
Fixing this bridge, building it at such a high standard would, of course, solve this problem. So I see that the foundation is deep enough. I see that it's wide enough. I see that it would be able to cater for any level of rain that would fall again. And so this would, of course, contribute significantly to the community in terms of, handling their level of productivity, handling emergencies. It would really help the entire parish and, of course, the island.
Project engineer Khalil Saliba says the Pointsville Bridge will be completed in 3 to 4 weeks.
This bridge, it will take 4 to 6 weeks to be completed. But in general, this project, Pointsville to Morne Fondu, we achieved over 55%, as I said, of completion for the moment. This project is composed from 3.75 kilometer for road execution, 4 bridges, retaining walls, box culvert, all kind of concrete works. So we get the letter of commencement to start here June 1st. We're supposed to deliver June 1st, 2019. So we're supposed to deliver June 1st, 2020. But because we have stopped due to the COVID pandemic, COVID-19, over 2.5 months to 3 months. So we get an extension to be delivered this project by November 2020.
Finally, in the news, on Monday, July 13th, all constituency parliamentary election offices reopened their doors for operations after being closed for a few months due to the COVID-19 pandemic. In this Abigail McIntyre report, we hear of the services being offered and the measures being taken to protect staff and visitors.
All 19 constituency parliamentary election offices will operate between the hours of 9 a.m. and 5 p.m. as of Monday, July 13th, 2020. Persons will be able to go in to re-register, have IDs replaced, and register as a new voter. Prior to the state of emergency that was imposed on Grenada in March this year, the offices were engaged in the re-registering of voters and the re-issuing of voter identification cards. The new cards are ready for distribution and will be done in 2 tranches.
All the persons who applied during the month of February, these persons can come to collect their voters' ID as of today. Persons who applied in the month of March, these persons pretty soon, and I believe maybe as early as next week, we would make the announcement encouraging such persons to come and to collect their voters' ID. That's for persons who applied in March.
That was Voter and Civic Registration Officer with the Parliamentary Elections Office, Ferdinand Phillip. All COVID-19 protocols will be maintained at the various offices. Visitors must wear a mask, sanitization of hands upon entry, observe the social distancing rules while waiting, and only 1 person will be allowed inside at any given time. The new IDs will be valid for 10 years and will take about 3 weeks to be renewed. Mr. Phillip reminds persons that they ought to visit their appointed constituency parliamentary offices and not the headquarters in Old Trafford, St. George.
I live in St. Andrew. I live in Subi to be exact. I cannot go in any other constituency and get registered. I can only go in St. Andrew Southwest. That's, I believe, on a Gladstone Road there. That's the only place that I cannot go in Grenville, downstairs the agriculture building. I cannot go in Paradise. I cannot go in Marybow. I cannot go in St. Patrick East or West. I cannot, in no other place I can go except in the constituency where I live.
For faster service when registering, walk with your passport. If you do not own a passport, a valid birth certificate can be used as an alternative. For the National Report, I am Abigail McIntyre.
Thank you, Abigail. Recapping the main headline. More than 7,000 Grenadians have benefited from COVID-19 stimulus package and unemployment benefits. On behalf of the entire news team here at the Government Information Service, thank you for joining us. Until next time, I am Rakisha St. Louis.